Okay, great. So, and I'll set a timer so that I don't go over. So as Nick said, I'm at Wake. Just to advance one slide. Is this it? Yeah. I am super technical. So basically, I don't like PowerPoint. But basically, this is non-traditional applicant. So what is a non-traditional applicant? Right? So they pick the most traditional looking guy to be the non-traditional applicant talk, right? The old white guy, right? Well, so old, that's what most people think of as classical non-traditional. Someone who didn't go straight through high school, undergrad, med school, straight into residency. So that's really kind of the big thing a lot of people think about is non-traditional. So maybe you've got a different background. Maybe you took some time off. Maybe you were in the military. Maybe you did, had a cool job. There's a lot of cool things you can do before you decide you want to come into this cool thing called emergency medicine, right? Maybe you're the first person in your family to go to college. Maybe you were homeless. Maybe you were homeless in med school. Maybe maybe you've had some other setbacks or other things that can make you non-traditional. The international medical graduate, that's another form of non-traditional, but it's really pretty classic because that's a huge group of folks that are there that have done that maybe they went straight through, maybe they didn't. But the non-traditional portion you think of, everybody wants to think, I want to go start here and I want to be happy, right? I want to get to that point, and we want to get there as quick as possible. And a lot of times you're going to have some detours. You're going to make some turns, and you're going to go to some places. You're going to get into some cul-de-sacs, turn around and be like, man, I'm not in the right spot. I got to get out of here. Or you may stay there for a little while, and then you come back out and you get back on the path and you get where you're going. So how do you get where you want to go? Well, you guys have all taken the first step to do that, right? Everybody here is interested in emergency medicine in some way, shape, or form. And you're really interested in getting yourself into an emergency medicine residency because you're at this type of a program. So this is one of the first things you can do. Kind of identify what makes me different as an applicant, right? You've heard all these folks who are taking their time out to tell you what they look for in applicants and what you should do and how you should look as an applicant, right? And not physical appearance, but how you should look. Part of that's physical appearance, like dress for the job, right? Yes, we do wear scrubs at work, but don't show up for your interview in scrubs. You laugh. You laugh. It happens. But seriously, think about how you can package yourself. Think about how you can make yourself look like the most attractive person for that program, right? And what is it about your non-traditional background that sets you apart? Did you spend time, we've got some folks here who were in the military. Did you have a successful military career? Did you have a not so successful military career, right? You got injured, you weren't able to do the things you wanted to do. Did you have a business where did you take time off and raise a family? Did you decide that you wanted to come to medicine after you had another career? There's a lot of things that you can do that sort of pull you into medicine and make you a much better applicant and make you a much better resident, right? Your first job, I will get up here and say, your first job should never be being a doctor. Like, you should never go through school and your first job, real job, be a doctor. You should have had some job beforehand because, particularly emergency medicine, I would recommend something in the service industry because that's kind of what we are, all right? It's kind of like Walmart. You can go be a greeter at Walmart. It's basically the same as being in triage, kind of dealing with people every day. But think about it. When you are a non-traditional applicant, what is different about you? What sets you apart? And that's what you want to highlight in your application. That's what you want to really push out to these programs and be like, look, I'm the person for your program. I have been successful in this endeavor. I've been successful in this endeavor. I'm successful in this endeavor. But I'm also teachable. Don't be so successful that you can't be taught something. Okay? The people that were at my table earlier, we talked about pita. So like, pita bread? No. Pita's like pain in the ass. So what's your pita potential? No, low, high, So if you can be really successful at things, you've done a great job, you can come in and be confident about it, but don't be overconfident. Sell yourself, but don't be, how are y'all doing today? Sort of the Captain Morgan, right? You're just ready to go all the time. But be able to be, you have to be teachable. Because we will see people who are horribly successful at great things, right? Or wildly successful, not horribly successful, but they're wildly successful. And great scores, great grades, and we won't match them. We won't rank them. Because you can't work with them because they're not teachable, right? Just because you've achieved a lot of things outside of this, you're coming to emergency medicine because you want to learn emergency medicine. And if you come into it with a mindset of like, I need to know how to learn to be an emergency medicine physician. That's why I'm coming to your program. That's why I want to do that. So you can draw on your strengths of the diverse background that you have that got you to that point in that application process and highlight those things. There's really There's no barrier other than the barriers you construct yourself. And that's the biggest thing, is we will sometimes, particularly those of us who are older or who didn't go to a school with emergency medicine program like I did, I had no idea. So I had to go out and try and find places that I could get rotations and do things. And all the deans were like, you're never going to match in that. You're never going to match in emergency medicine. Why would you do that? You should do family medicine. Because they wanted everyone to do family medicine where I went to medical school. So we limit ourselves in a lot of ways because we don't know what we can do and what we can achieve. You can do anything you want to do if you really put your mind to it, for the most part, right? You have to be honest. Part of that is being honest. As a non-traditional applicant, are you going to get a second look in some areas where they're like, throwing the filters down. If you've got really crappy grades and really crappy scores, you got to be honest with yourself. Emergency medicine is getting really pricey. It's hard to get in. That level gets higher and higher every year, where we get these folks with really crazy board scores. Like, I didn't even know they went that high when I'm reviewing people's applications. I'm like, dang, I wouldn't even get an interview at my place now. I'm like, this is crazy. But, you can still overcome some of those things. But looking at your differences, you should embrace those things and really look at that as a way to enhance your application and to really give you that extra bonus. So, you're non-traditional. That means you've got something else going on. You've got something that is going to add to that program, add to the diversity of that program, right? Everybody may look the same, but that doesn't mean they're all the same, right? Just because people look very similar doesn't mean that they don't have different backgrounds and different experiences. And so you can highlight your differences and your experiences and how that can contribute to the program. And that's really one of the benefits that you have when you have a diverse background. And that's what all the programs are looking for. They want people who are going to show up, work hard, try not to be stupid, and not lie. That's really what they want, right, Nick?
Absolutely. Right, Gannon? As mentioned before, I think Gannon's talk said, "Don't be an asshole."
Yeah. Right.
So one of the things that you said just really resonated with me, and it was I had a conversation at our table with a student who mentioned, what she called, if you don't mind me saying, was baggage. And I said, baggage is only baggage if you call it baggage. It's life experience in most cases. And you guys had a session on the personal statement, and that's your chance to turn that, what you think is baggage, into life experience that allows you to relate to your patients. And we have one of the most tolerant specialties. I mean, we take care of the homeless and the addicted and the psychotic and the rich and the poor and everyone in between. And so I think as people, we're also very tolerant of people with a non-traditional path to where we're going. So I totally agree, and I second what you said.
Yeah, and I think making that, sort of highlighting that, how that's going to help you be a better provider. You don't have to say, oh, I got addicted to drugs so I could be a better provider. Don't do that.
That is baggage.
That kind of borderlines on baggage. But the natural life experience, right? You can talk about kids. You can talk about these things, like the things that are going to help you be a better provider and a good person, right? It's not rocket science. It's not hard. The hard part's getting in. It really is. And then there's just hard work through anything you do. But any specialty and anything that's worth anything is going to be hard work. But if you really enjoy doing it, it's not as hard as if you don't, right? So this is a super simple, sort of reduction in what is non-traditional, what's traditional. If you went straight through, you didn't go straight through. If you've got family, you've got kids, you've got prior service, you've got jobs, you've got other things, you're coming from another country, you're coming from an offshore program, then you're not the classic straight traditional applicant. But it doesn't really matter. They're looking for good quality applicants. And what you have to do is highlight the things that are good and that are high quality in your application. And that's really how you're going to get yourself to that next level and get yourself where you want to be. And everybody here, you can see, everybody here has put their emails up here, right? So you can reach out to any of us about any questions you have. I guarantee that I will probably answer your email. If you haven't heard from me, if you've emailed me and you haven't heard from me in a week, email me again. Because sometimes I do, like Nick said, I do a lot of wilderness medicine, so I take multi-day trips, have a couple of week to 10-day long trips coming up this summer, and I will not be answering my phone. because I will not have cell service. So, but seriously, what questions do you all have? I know there's some questions.
Can I ask you something that you
Yeah.
and I talked about in the preparation for this, and it came out in our lunch table? How do you find programs that are friendly to some of the categories of people that we talked about? Students at osteopathic institutions, international medical graduates, non-traditional applicants. One of the things that I said, I was fairly transparent that there's programs where if you pull up their list of residents, there's an MD next to every name, and people look fairly similar. And there's programs that aren't that way. So if you could just comment on that for a minute.
Yeah, so the unfortunate part is there's not a database anywhere where you can plug in and say who's DO friendly, who's IMG friendly, who's, whatever friendly. There's not that level of meta search out there, but someone in the audience could probably figure that out. But it takes you looking at each program that you're interested in. You're genuinely interested in applying to a program. Look at those programs and look at their residents. Look at their current residents. Do they have former residents listed? And it takes a couple clicks. You can see where they went to school. Did they go onshore, offshore, DO, allopathic, and then branch it out. Look at their faculty in emergency medicine, and then look at faculty in the rest of the institution. If it's a place you're like, I really want to go there, but they don't have anybody listed that's the DO. They don't have anybody listed that's the DO in any, on their faculty or in their residency. Hey, but it looks like a lot of the other programs in the hospital have DOs there. So you can reach out to the program and say, hey, I'm interested in doing a rotation there, or, is there a reason why you don't have DOs? They're not going to out front answer that most of the time, but we don't take DOs. But you can sort of ask around, right? Ask somebody from your school that's gone there. Ask somebody from another school if you have friends from undergrad who've gone to that school. You have to do a little bit of detective work where you're kind of going through and saying, hey, who do I know that's ever been affiliated with this program or with this school? And the other part is the folks, if you're in a school, that is a DO school or international school, where have your graduates gone before, right? The people that are in front of you paved the path for you to follow. And you can take that road a little bit further than they did, but that's a good starting point to look at where did they go to school, where did they go to rotations, where did they do residency at. But starting at the website, most websites are going to have the credentials of their residents and their faculty. And then, if you're interested in that program, like I said, just reach out to them. It can't hurt, right? As long as you don't send them like a threatening note, right? We were joking at the table. If you send them an email that looks like a ransom note and you talk about picking up their dog and things like that, don't do that. But you can talk about how you're interested in their program, giving some specifics about how you're interested in the program, like other people have mentioned. Not just, I like your program in Colorado because I want to go ski.
We get a lot of those emails.
They really do. And so, have something that you really like about the program. The fact that it's a 4-year program gives me an extra chance to learn more, as opposed to some of the 3-year programs, or whatever you want to highlight or pick up. They've got a strong EMS presence, or they have a strong other presence. What else? Any other questions? I know you guys are at the end of the day.
I would just dovetail on that, tying back to what Dr. Kass talked about early on with mentorship, finding those programs that have had people like you in their program, but also even targeting those people, right? Find somebody who did it. Find a DO or international grad who got to that place and ask them how they did it. And I think that it's a lot easier to make those connections with social media nowadays. So feel free to reach out to those people and just say, hey, I'd love to pick your brain. It looks like you got where I'd like to be. How'd you do it?
And most people are super flattered if you do that.
Yeah.
They're going to be like, oh, wow, somebody wants to be like me. That's awesome. What else?
All right, thanks, guys.
Hey, thank you all so much. Thanks so much for the opportunity.